We sometimes eat like this.
Mm. Mm.
As you see, these two mean excessive intake of sugar without exercise can get you diabetes. Now we're going to talk about diabetes. Firstly, what is diabetes? Diabetes is a disease showing symptoms of high concentration of carbohydrate in blood and sweet urine because of defective glucose and water transport. There are two types of diabetes. Type 1 diabetes occurs when lacking of insulin because of dysfunction of beta cells in pancreas which produce insulin. Type 2 diabetes occurs when cells in the body don't react with insulin because there are not enough of insulin receptors in the cell membrane. Then, let's find out the mechanism of glucose transport.
At first, glucose transporters stored within cell in membrane vesicles. Second, when insulin interacts with its receptor, vesicles move to surface and fuse with the plasma membrane, increasing the number of glucose transporters in plasma membrane. Third, when insulin level drops, glucose transporters are removed from the plasma membrane by endocytosis, forming small vesicles. Fourth, the smaller vesicle fuse with larger endosome. Fifth, patches of the endosome, enriched with glucose transporters, bud off to become small vesicles, ready to return to the surface when insulin levels rise again.
Diabetes is not the problem of your neighbor. This is so serious that your friends, family, and even you could get this disease. In 2013, according to International Diabetes Federation, in short, IDF, the worldly diabetes population is about 382 million, which is 54% of overall. In North and South America, it's 61 million. Europe, Middle East, and Africa have 111 million. Southeast Asia has 72 million, and Western Pacific has 138 million, which is the most in the world. Then, how do we deal with diabetes? There are three treatments for diabetes. First, avoid high carbohydrated food, candy, chocolate, beverages, and even bread and rice have high concentration of carbohydrate. This kind of food can increase the rate of carbohydrate in patients' blood. Second, constant exercise. Simple exercise which is not harsh, such as walking and light jogging, can help in decreasing of carbohydrate rate. But if it's too harsh, it could get the patient exhaustion because diabetes distracts metabolism in the body, which produces energy to work out. Third, medicine. This is the ultimate and the most important therapy of diabetes. Insertion of insulin for type 1 diabetes and oral hypoglycemic agents, in short, OHA, can help weaken the symptoms of diabetes. Beside of these three, having a regular life like sleeping well and regular meal time and amount is needed for the cure of diabetes. The important fact is that all therapies have to be used, not just the individual therapy. Then, how do you decide whether you have or are possible to have diabetes?
Let's check how many you got.
First, there are diabetes patients in your family.
Mom, do you have diabetes?
Yeah. Oh.
Really?
Second, you're middle-aged. Third, you're fat. Fourth, you eat too much. Fifth, you lack of exercise.
Don't you walk?
No.
Sixth, you are constantly thirsty.
I'm thirsty.
And the last, you have dull eyes.
Oh, what's this?
Checking yourself. If you have 7 of these, you're sure to have diabetes. 5 to 6, you need to consult with doctors. 3 to 4, you need to review your symptoms carefully. 1 to 2, you're recommended to have a good daily routine. As you see in the video, one little daily action decides whether you get diabetes or not. The answer is we have to have a healthy daily habit to protect your body from diabetes. Enjoy your healthy life with a little effort.
Thank you.
Thank you. Thank you.